Hello viewer, welcome back to my channel. If today is the first time of you seeing my video, do well to subscribe, like, share, put on your notification bell. Welcome. So today we're going to be talking about health. I know I've not really spoken anything about health, though I'm a medical doctor. My name is Dr. Ogenete Gagere. So but we'll be talking about health. A lot of time people don't pay attention to their health. A lot of time we are too busy, maybe the condition, the kind of environment we find ourselves, work here and there, we are too, even when the body is yelling or giving you some signs, we just assume we are fine, nobody cares, we want to just keep going and living our normal life and all of that. So it doesn't really help a lot. So we're going to be talking about health today, so stay tuned as we jump into it. Alright, so let's talk about some things in our heads. What is the greatest need of a dying man? Can you stop for a moment and think? If a man is on the sick bed, what's the greatest need? What is the greatest thing that he will yearn for? He will yearn for life. And what is life? Life is health. If you don't have life, if you are not alive, you don't have good health, you can't really do much of the things. Take for instance, you have money, you have cars, you have building, you have children, you have a lot of things. But those things won't count when there is no life. Those things will count when you don't have health. Those things will count when you're not alive. So the greatest need of a dying man is health. So it means your health is that valuable, your health is that important. So why have you neglected it? Knowing that if you don't have life, you can't really do much. All right, when there is life they say there is hope, so it's something you should always keep in mind, that as you are working, pay attention to your health. So I'm going to be outlining some few things, some few tests, some few check-up you should be going for. One of them is you should be checking your blood pressure regularly, your blood pressure monitoring. Check it regularly, whether old or young, most especially for older people, say above 40 and all of that. You should go for more check. But these days we have even younger people who are coming down with hypertension. So whether you are old, you are young, keep abreast, checking your blood pressure so that you have an idea, because this thing does not really have sign. Another thing you can do, at least maybe every 3 months or so, 3 to 6 months, you can go for regular, you can be checking, just check your blood sugar to know what's your level of your blood sugar level. These are just things you can do. You check it so that you know if you are tending towards diabetes or you are pre-diabetic, so we can easily start working on it on time. So you do that check as well. If you're a sexually active female, there are some preventive steps you can do. You do the whole called pap smear. All right, this help to prevent against cervical cancer. You go there once you are sexually active female. We advise that you do your pap smear. It helps to prevent against cervical cancer because it's a deadly disease that doesn't really have any cure. All right, another thing you should check out for, you need to know your family history as well, so that it will help you to know the things you should avoid most, because your family, if you have family history of hypertension, family history of diabetes, you are the type of person who should be very much careful with things that can lead you to having those type of disease. Then another one, go for dental checkup. Go and check your teeth. Most of the time we don't do that. Go and meet a dentist at least twice in a year. You can do that. Let them have your teeth checked. There are some things, there's what we call dental caries and periodontitis and some other things that can affect your teeth. Sometimes you see people who have holes in their teeth and so many other complaints. So go for it at least twice in a year. It will help to build you up. Then the next thing to check is your BMI. BMI means body mass index. So it involves your weight and your height. So you check your weight, you check your height. There's a calculation we can do to be able to let you know if you are overweight, you are obese, you are underweight. So those are the things you do need to check. So if you have not done it, it's something you should go and check. Another thing is PSA, prostate specific antigen. This one, once you are above the age of from 55 and above, is mandatory, is important to check. It's part of the guideline that you go for a screening, a PSA screening that help to screen against prostate cancer and the rest of it. So it's good you check it. But you can also start checking it from the age of 45 to 55 if you have a first degree relative, someone like your brother, or if your father has had this history of prostate cancer, or maybe if you have two extended members of your family that has it, it's still good you go and do it. Then another thing I want us to look at to also check is lipid profile. This one help to check the level of your amount of cholesterol in your body. So you go and do your lipid profile, which show if your cholesterol is too high or is getting high, so you can easily work on it. The prevention is better than cure. So if we can get to know the value on time and see if you attend it, we can now best advise you and tell you some things that will help you to stabilize your body. So it's important you go for all this, and there are some other things that I didn't mention, but this is just an insight to what you really need to do. So pay attention to your health, do the little you can do, check yourself at interval. You must not wait until you are sick before you go to the hospital. All right, do your exercise, eat good diet. Then anytime you notice a challenge, just always call your doctor, go to the hospital, let them have your examine.